Hi, today we're going to talk about spinal posture. We're going to emphasize the cervical spine or emphasize the correction of the cervical spine posture, but in a standing position without thinking about the lower back and the mid back. It's hard to correct the cervical spine. So we have three curves in our spine. The lower back and the neck have a similar curve in which there's a concavity, and then the middle back there's a convexity here. So in correct standing alignment, you should have a little curve in your lower back, and more importantly, we're going to talk about head alignment. So most people are in a forward head position, meaning their chin is stuck forward. Why? Because we look at TVs, we look at computer monitors, we're looking down at our cell phones, and everything is in front of us. Well, that produces stress where the cervical spine or the neck meets the thoracic spine or the mid-back, as well as puts a compression on these very delicate muscles, suboccipital muscles at the base of your skull. So the first thing that I do with any of my neck or cervical or any of my neck or headache patients is talk about getting out of that forward head posture. Necks are very delicate, so do not push this to an extreme. Think about small changes in your alignment, because big changes can make big problems with the cervical spine. Ideally, what we're trying to do is get Amanda's ear in line with her shoulder. That's the ultimate end goal. That will take weeks, if not months, to work on that with some of my headache patients. So thinking about bringing that head directly back, keeping your eyes level. We're going to call that cervical retraction. And that's what we're going to start out with today. So there is one exercise I'd like for me to teach you, and we can do this actively and or passively, and I think for right now I'm just going to show you actively how to do it. So you're going to stand up, and standing up's better than being in a seated position, and you're just going to think about, and ladies hate this, but you're going to think about bringing that chin back and making a double chin and relaxing. Back, relax. So we're going to do 10 of those. So man, if you could do another 7 of those, bringing that head back. What that's doing now, that's counteracting all those bad neck postures that you've been in throughout the day. What that's doing, that's stretching that lower cervical spine as well as those suboccipital muscles at the base of our skull. So that'd be a very simple exercise you could do, but again, be very careful with that, because particularly if you're a headache patient, that can really stir things up.